There's been public outcry, displeasure, and concern from well-meaning Nigerians over the health crisis and mysterious deaths of citizens in Kano. Can you give us a brief assessment of the situation in Kano at this time?
Okay, so apparently there are multiple media reports, initially mainly on social media before it actually gained traction to involve the mainstream media in reporting of an increased number of deaths from an unexplained acute illness in the population. However, there wasn't anything documented, so to say, in terms there wasn't any robust research, trying to get to the root of the cause of those deaths. Because of the fear of increased community transmission of this COVID-19 virus, a lot of people were rightly afraid that it could be as a result of that. However, the state government, having initially refuted the report, decided to institute to constitute a committee to investigate this problem. I don't know the outcome of the investigation because it has not been made public. However, there are a few good Samaritans that have taken it upon themselves to do some research. And I recently came across an online survey by a fellow in the Department of Mathematics, Yusuf Yau, in Kano State, Yusuf Maitamasula University. So the online survey basically just showed that there was an awareness, like 95% of the respondents were aware of an increased number of people that were dying, and it was actually not ordinary according to the respondents. So we would say with a certain level of confidence that yes, it's happening in Kano. However, it's really difficult to ascertain the exact causes of death without any rigorous, research-oriented questions.
Dr. Zayad, let me just quickly coach you in the debate. The Kano State government actually came out to say that the cause of death of those Kano residents were actually because of malaria. I mean, has that been refuted? Are you saying that is unfounded?
Well, from anecdotal evidence and a few of those online surveys, I would say that it might not be correct to actually attribute those deaths to pneumonia and malaria and hypertension, the way the preliminary reports said. However, having said that, I would want to believe that what the state government released was a preliminary report. I don't think they released any report that would be conclusive in saying that those cases were mainly as a result of malaria or hypertension, because from anecdotal evidence, we saw that a lot of these patients actually died from mostly showed some acute febrile conditions before eventually passing. So I would not want to attribute everything to diabetes and hypertension without really cross-checking the rigorousness of whatever research that the government has conducted.
Now, Dr. Zayad, let me also clarify this. Dr. Tijani Hussein, that's the coordinator of the Kano State Technical Response Team on COVID-19, said that they actually opted for verbal autopsy from the families of the dead persons. And part of his argument was that, according to him, the religion of the majority of people in the state does not encourage autopsy before burial. Could you clarify this, please?
Yes, it's actually right. The religion in most northern states actually does not give so much room for a complete autopsy to be done, because according to Islamic religion, a dead person should be buried as quickly as possible. A lot of these deaths actually did not happen in hospitals in the first place to warrant even an autopsy. So I believe that would be what was responsible for the state government opting for verbal autopsy. It's actually a validated tool for assessing, trying to find out causes of deaths in large population-based studies. There is nothing wrong with verbal autopsy if it's done correctly.
Okay. Yeah. Of the 195 new cases, Kano was said to have reported 38 new cases. That was as of yesterday, and bringing total confirmed cases in Kano to 115 cases. Why is the number of cases rising exponentially in Kano at this time?
So, like I said, I think we do have reasons to believe that there is an increased rate of community transmission going on in Kano. It's not in my place to actually, guess or, extrapolate, because I don't have all the data. But from what we're seeing around, there could be much more than that, because we all know that we actually get what we test for. We don't see cases if we don't test for them, and we all know that the Kano lab had some issues, and it was shut down for a couple of days before it resumed operations yesterday. So I believe that with more testing to be carried out in the future, we could even potentially see much higher numbers than that.
Let me clarify this. Has the suspended operations of the NCDC testing laboratory in the state been reactivated at this time?
Yes, it has been reactivated.
Because all Kano testing samples were being sent to NCDC Abuja. Now, the question we want to find out is, what will be the likely impact on the Kano figures if the Kano testing lab have resumed?
Yes, like I said earlier, I think because the lab has resumed, and then there is coordination from with the presidential task force that have sent their members to Kano, and then increased participation of the NCDC national. I think the numbers are likely going to increase because of nothing rather than increased testing capacity. If you don't test, there's no way you will see the cases. We believe that the cases are there. We believe that there is an increased community transmission rate, and the only way we are going to see that for sure if we resume testing in full capacity. And in the future, we hope the government would make efforts to increase testing centers across the states, and that's when you would begin to see the true picture of those infected.
So how many testing centers do we have in Kano at this time?
As of now, I believe we have one testing center in Kano.
Wow, that's not too good. What is the government actually doing to ramp up the testing capacity as far as the state is concerned? Do you have any?
So from what I gathered, I believe the state government is working together with the NCDC and the presidential task force to, first of all, increase the testing capacity of the present lab here, and then increase the number of testing centers in the state. I don't think the testing centers would be increased in the next few days. However, I think there are plans underway to see that some testing centers are introduced in Kano.
There are those who are medical doctors like yourself who are in the front lines. What are the major challenges they are facing in Kano at this time? Based on your assessment, especially medical workers who are in the front line against the fight against COVID.
Yeah, well, initially we had major problems like provision of personal protective equipment. But as I'm speaking to you now, the condition has remarkably improved. And I believe our biggest problem now is the low testing capacity that we're experiencing, because we have a lot of patients with symptoms that are similar to COVID-19 symptoms that need testing, and because of the problems we're having with the labs and all that, we are not able to test them. So I think that's the biggest problem we have now.
Most of the reports that we are getting say that the treatment of coronavirus is directed at relieving symptoms and may include pain relievers, medications like chloroquine and all the rest of them, and including rest and fluid intake. But there is no known cure yet. How are patients being treated?
Well, so the standard treatment is just like you mentioned, elevation of symptoms. If somebody is febrile, for example, try to help bring down the temperature. If there's evidence of dehydration, you ensure adequate fluid replacements. In the case of chloroquine, I would not want to speculate on that because it's still not properly documented. It's not established beyond reasonable doubt that chloroquine is useful in this case. There have been conflicting reports with that. And then because of the toxicity of the hydroxychloroquine itself, I wouldn't want to encourage its use without adequate prescription from the relevant bodies. However, like most viral illnesses, the important thing is supportive treatment before the disease runs its course. That's before the body gets rid of the virus.
Oh, great. So finally, just to get your perspective on this, considering the efforts that have been taken in order to contain the virus, what efforts do you think should be taken beyond just the lockdown?
Yeah, so the important thing about lockdowns are they are meant to decrease community transmission rate and enable the healthcare system to work so that it would not be overwhelmed before a definitive cure is found. So I think the most important thing, apart from the lockdowns, will have to be increased testing capacity. Increased testing will ensure that you remove most of those patients that would potentially infect other people that don't have the disease, and then it will help in decreasing the spread of the disease. So I would say increase testing capacity, then you do promotion, health promotion, public awareness about the importance of personal hygiene, hand washing, use of hand sanitizers, use of face masks. I think that is the most important thing we should be doing right now before something comes up in terms of definitive cure or vaccine, which is a long way from now.
Dr. Zayad, thank you very much for your insightful analysis and perspective. We hope we can get back to you as events unfold in Kano.